True or false, PMS or premenstrual disorder, or that's PMD or PMS, is just something women have to live with. Is that true or false?
False. Unequivocally false.
Number two, is painful menstruation normal that women or girls have to just accept?
Absolutely not. We say it's common, but it does not mean it's normal.
What's one thing every woman should know about their period or menstrual cycles, but probably they don't? Hi, everyone. Welcome to one more exciting episode at Hormones and Podcasts. I do a drum roll for some special guest, and that's a drum roll for today's guest, Dr. Monica Minjeur. She is a founder and CEO of a special clinic in Midwest in Cedar Rapids, Iowa, which is called Radiant Clinic. And it's very impressive to know, which I've learned recently, I would say in last 1 year, about what she does. So she's a board certified family medicine, an expert or specialist in something called as Restorative Reproductive Medicine. So she's working with women as well as couples in their, in of course, when you call it as family planning, that's what she's helping them with. But it's very impressive when you hear the word restorative reproductive medicine. So she's got this additional specialized training in certain procedures, which she'll elaborate on. What fascinated me was this field about her that she's practicing and implementing, and also adding on to the education out in our country and the world about using fertility awareness methods and to target the root causes for all the reproductive, menstrual related concerns, PCOS, PMS, PMDD, and the list goes on. So, without further ado, welcome Dr. Minjeur.
Thanks so much. I'm excited to be chatting with you today and to talk with your listeners and share my story.
Yes, please do. So, when we start, we would really love to know about you as a person, as a human being, as a professional, and why you started, or why this specific field that you've specialized in, and your work in your practice, in your community, as well as out for our nation.
Yeah. So thank you so much for that. And as you mentioned in the introduction, I'm just incredibly passionate about the work that I do in restorative reproductive medicine. And really where it started for me, I was in medical school and I had a cousin of mine who actually developed a blood clot while she was on birth control. And they went through a very extensive process to determine was there anything else that was playing a role, and they determined no, it was unfortunately just a side effect from the birth control pill, which can happen and it's not incredibly common, but it certainly is a potential. And so it really got me thinking more about, well, what else was she going to do now? She had suffered her whole life from very heavy, irregular periods, but now she couldn't be on birth control because she had had this negative side effect. And so I thought, well, what other options does she have? And it really started me on this journey to finding additional answers for people that either couldn't tolerate birth control or maybe chose not to be on it, or more importantly, for the woman who has irregular cycles or symptoms, but who wants to also get pregnant. Just being on birth control was not going to be a good option for those women. And so found this field of restorative reproductive medicine. And really the whole idea with it is restoring your cycles so that your menstrual cycles are back to normal. And that's has a very wide variation depending on who you talk to. But ideally, not having significant pain, having cycles that are roughly 30 days apart, not dealing with debilitating migraines or acne or other pieces that come along with it, and all in a way that works together with all of the other systems in our body. So helping to heal all of those other underlying conditions that may be playing a role when it comes to your menstrual cycles. And then really also being able to tag in that fertility piece of it. So not just the women's health, but also focusing on male factor fertility as well. So we do treat that within our practice as well when we're dealing with couples struggling with infertility. We're looking at both the male and female factor of things. And that's really the whole idea behind restorative reproductive medicine, is restoring our bodies back to their normal function so they can go on to have normal reproductive health.
Wow. Yeah. We've had a few reproductive endocrinologists on our podcast, and it's been different topics that we've talked about. But what was impressive is, your field where it's going even prior to thinking about conception. It's also the reproductive phase for the girl or the young adult woman, and what she's going through in terms of restoring it, like just the way you said. So that's It's a niche that is very much needed. And I'm glad that today you're going to share your expertise on that. So, what exactly is happening out there in our nation, which is even more important today, where our women should be aware and our men should be supporting it? So, can you tell us, just share some updates as to what's happening and what's your work involved in the community?
Yeah. So one of the other hats that I wear is I am the US Director of Communications and Development for a larger medical society, and it's the International Institute for Restorative Reproductive Medicine. And really, it is the medical specialty group that is kind of overseeing all of what goes on as far as bringing all of us doctors together. And so, as part of that role, I do a lot of education not only to the public and to politicians, but also to the media and the general public as far as what is it that we do within restorative reproductive medicine. And, I think that one of the most challenging pieces about that is this is not a political issue. This is not saying one method is better, one method is worse. We certainly have data that we like to share to educate people, but it's also really important that women know that there are other options because so often women go to see their doctor, they're told, well, your only choice is go on birth control, and then if you want to get pregnant and you can't, your only choice is IVF or IUI. And really, we look at this from a standpoint that women need to know that there are other options. And men need to be able to help support their partners in order to be able to say, yes, there are other things that we can look at here. And it might not just be a woman's problem. There may be a male factor that's going on. And so, really, just educating people and helping them to see, wait a second, this is not just black and white. There are not just two options here. There are many other choices in between that you may be able to get better health overall rather than just looking at the end point of, do I have a baby at the end of this treatment or not? We provide answers for if you can't get pregnant, why? And what can we do to help and improve that? And so it's been a really important role. And I've really been honored and pleased to be able to work in that space because when it comes to healthcare, we all should be empowered on how to have those conversations with our doctor, how to be able to be a good advocate for your own health. And I really believe that is the key in order to helping improve that patient doctor relationship. We have better outcomes when patients are informed, when they're not just told, this is your only option, this is what you have to do, but when they can become their own advocates, it makes all the difference in the world.
Absolutely. So well said. Knowledge is definitely the power and it's empowering. So thank you for doing what you're doing, Dr. Minjeur. With our podcast, so we usually start with our rapid fire questions, and it could be true or false, one liner. And if you feel like you need to deep dive into it, we can do that after the rapid fire. So ready?
Sounds good. Let's go.
True or false? PMS or premenstrual disorder, or that's PMD or PMS, is just something women have to live with. Is that true or false?
False. Unequivocally false.
Number two, is painful menstruation normal that women or girls have to just accept?
Absolutely not. We say it's common, but it does not mean it's normal.
Okay, thank you. Can tracking your cycle, which is menstrual cycle, actually improve fertility outcomes?
Yes. And I would say one extra line with this is that many women think tracking their cycle is just about tracking their period. And in our world, we say it is also about tracking your ovulation and your fertility window. We can teach women how to do this. And that is the key to improving the fertility outcomes is knowing the ovulation with your tracking, not just your menstrual cycle.
What's one thing every woman should know about their period or menstrual cycles, but probably they don't?
My favorite thing to teach women about their cycles is that your day of ovulation can change every month, and that is very common. But the time between when you ovulate and when your next period starts is typically the same every month within one day for most women. So if you can identify that day of ovulation, you can pretty reliably predict when your period is going to come after you've been tracking for a couple of cycles. And it's really, really fascinating to watch that.
That's knowledge. Impressive. Number five, what's the most common reason patients come to you, be it men or women, that actually surprises you?
It's not surprising because it's bothersome, but it's troublesome when women come to me and they were told that they needed to go on birth control for XYZ symptom. And they've come to me 20 years later and they say, I'm still on it, but I don't know why, or I don't know how to get off, or I'm afraid to get off. And again, it's very common. But it's really disheartening sometimes that the pill seems to be the fix all for everything, and women are never given another option. But very common.
Thank you. So we're going to learn more about all this. I would love for you to start with, because you actually gave us a very lovely fact about what many women or girls are not aware of about the menstrual cycles. So how for you, like the restorative reproductive medicine, right? And we are going down the path where the girl or the woman is not thinking about fertility, but has trouble or some kind of a pathology or symptom with the menstrual cycles. So, what is that analysis for you as an expert for the menstrual cycle analysis? If the female is coming to you with a specific symptom, it could be pain, it could be heavy flow, it could be unpredictable cycles. So, could you walk us through your history taking and then what's happening next for that female?
Absolutely. So always starts with a history as far as what's going on. If it's a matter of something that is significant or, causing them to perhaps miss school or work or life because of it, then we always will start directly with medical evaluation, which typically involves some detailed lab work. We do a really deep dive. Most of our patients get labs done, and we're checking about 30 to 40 different lab tests in order to determine what's the true underlying reason that something is going on. So we typically will start with that. Sometimes it includes an ultrasound, which is pretty common, especially in our teenagers that are having painful periods or irregular cycles. And then from there, we also get them paired up working with one of our fertility educators in order to start really tracking and charting their cycles. Because again, as I mentioned earlier, if we can help to identify is ovulation happening, yes or no, as well as when it's happening, that helps give us a roadmap from day to day. What else am I experiencing? Do my symptoms seem to align with when I'm ovulating right before my period starts? Do they maybe have no rhyme or reason whatsoever? And it's akin it to if you are keeping a food diary, right? If we are trying to figure out what I'm sensitive to for foods, we're going to write down every single thing that happens in a given day and then look back. It's the same idea with the menstrual cycle, and we talk about the menstrual cycle as being a vital sign. So similar to how we would have people track a food diary or your blood pressure readings, we track what's happening with our menstrual cycle each day. And that allows us to then start to identify patterns over time as well as to time our interventions. So, for example, some medications are given only during certain parts of your cycle because we're trying to restore your cycle back to optimal health. And so, one of the primary hormones during our cycle is progesterone, and that only will increase after a woman has ovulated. And so if we're trying to help restore those progesterone levels and we're giving either progesterone medication or things that support progesterone, we only are wanting to do that after you have ovulated. So it becomes this tool then that we use not only for a diagnosis, but also for treatment going forward. So it really is this multifactorial team approach, but all starts with identifying what is the truest underlying cause that we can find that's causing these symptoms and then working together to figure out the treatment course as to how to correct those underlying conditions.
Does this include any form of, lifestyle changes or interventions that has helped your patients with similar scenarios?
Absolutely. So we always talk about, I kind of categorize three different buckets, if you will, as far as treatment. So the first category we always talk about are those lifestyle changes. So whether that's dietary changes or sometimes improving sleep patterns, reducing stress levels, getting regular exercise, or sometimes patients are getting too much exercise. So we talk about that, managing stress levels and managing mental health situations. The second piece we talk about is either supplements or food choices. So, if there are some things that you're deficient in, how can we get more of that into your world, whether that's through food or supplements? And then the third would be prescription strength medications. And not everybody needs things in all of the categories, but we certainly always will discuss what are the options. But absolutely, lifestyle is oftentimes the biggest thing that gets people into trouble. I always joke that if we could put you in a bubble and let you sleep perfectly and eat perfectly and have no stress, we wouldn't have any menstrual cycle issues. Now, that's maybe a little far fetched, but the lifestyle changes are really what help us to sustain so that when we do get cycles balanced again, how are we able to maintain those changes for the long run? and in many cases, be able to get women back off of medications that we needed to start in the process if we're able to address those lifestyle factors. So, yes, it is an important part of what we do, but it is by no means the only piece that we manage.
Yeah, yeah. So it's coming down to this integrative, holistic approach, which I really am close to. Yeah, with how you are addressing it, right? Because you talked about knowledge is power. You talked about empowering and also giving them those right tools, including the calendar, looking at ovulation, and then you mentioned about the pillars. So the lifestyle, the supplements, and then of course what medications or prescriptions. Could you elaborate on because now knowing how what specialty this is, could you elaborate on or help our listeners and viewers understand that when you talked about in the rapid fire that a menstrual cycle is not supposed to be painful for everyone or it's not a norm, so, why is that? And how can a female or girl or woman understand and then seek care? And what kind of care would that woman or a girl approach or seek for?
Absolutely. So, one of the most common things with painful periods that we see is that there are oftentimes underlying conditions that cause that pain. And we split them into two broad categories. So, one would be hormone imbalance. So, very common if a woman has too much estrogen, not enough progesterone. So, sometimes people know this as estrogen dominance. So, estrogen dominance can be a significant cause of painful periods, as can thyroid dysfunction, adrenal insufficiency, meaning my adrenal glands aren't working well. So, there are other things hormonally. More commonly, though, we see that this painful periods oftentimes come from something anatomic. And one of the most important things that we screen for in our practice is for endometriosis. So, endometriosis is going to be present in about 1 out of 10 women. And endometriosis can cause significant pain. And the average time to diagnose endometriosis can take 7 years to diagnose in some women. Now, part of what makes diagnosis so challenging is that it is really only diagnosed specifically by doing a laparoscopy surgery. So, taking a small camera, looking inside of your abdomen under surgery, and being able to identify if those endometriosis lesions are present. And so, it is challenging to diagnose, and it does require a specialist surgeon in order to treat endometriosis. Not all endometriosis surgeons are the same. And so it's really important that when we go through this evaluation process that we're identifying if endometriosis is present, what can we do to treat it? Now, there are some things that we can do from a medication standpoint to help with symptoms, but the definitive treatment for endometriosis, if that is the cause of the painful periods, is surgical excision and actually cutting out all the areas of endometriosis. And for many women, I've had hundreds of women at this point in time go through surgical procedures, and it is absolutely life changing to the point of they're able to function, they can get through their periods, they're not needing any pain medications. And really, when we see those quality surgeons, we're able to not have to go on and have additional surgeries, additional treatments down the road. And so it really can change the trajectory, not just of somebody's quality of life, but also can significantly improve fertility chances. We find that especially endometriosis that's causing significant inflammation can actually impair fertility and really cause problems with even getting pregnant in the first place, or can cause miscarriages. And so when we treat that endometriosis, even if you're not trying to get pregnant right now, again, we're going back to those basics of restoring your natural cycles so that somewhere down the road, if you do decide you'd like to get pregnant, then we're able to do so. And even if you're not, you're saying we're curing this endometriosis by removing it from your body. And so that's probably the most common thing that we see that we treat in our practice. Now, I'm not a surgeon. I work with a lot of amazing surgeons and in order to manage that part of it. But a lot of it is truly just in identifying that there is something wrong. And women being told just go on birth control, it'll cover up the symptoms is not the solution. That does not get rid of endometriosis. It does not cure it. It is just masking a symptom that will continue to cause problems over the years. And endometriosis, like I mentioned, can be very evasive to try and figure out. But once you have the right tools and are working with the right doctors to identify it and treat it, it can absolutely change women's lives.
Yes, yeah, that's one in 10. That's quite common. So, could you differentiate or help us differentiate what is considered to be an expected cramp or pain versus what's abnormal? So, how is a female or, say, a mother for her daughter, or a parent for their daughters, or younger females, younger female adults, or even a woman? How can they differentiate? Oh my gosh, this is not right. I need to seek care. Versus this is how it's been like. It's not abnormal. Is there a fine line?
Yes. So usually I say the most obvious is if you are missing work, life, or school because of it, or activities, or if you would like to miss them and feel like you can't. Certainly I have lots of patients who are nurses or teachers and they say, I can't miss school, so I just tough it out. Well, that's different. If you were at home on that first couple days of your period and that would be better for you, that would absolutely still apply. Or maybe you're the person who says, I am needing to take multiple different pain medications throughout the day. I'm alternating my Tylenol and ibuprofen every 3 or 4 hours just in order to stay ahead of the pain. That is not normal. The other is if there's other symptoms that go along with it. So if I'm having really heavy periods, if I'm changing my menstrual product, a tampon pad or cup, and I'm emptying it or changing it every hour, that's too much bleeding. Or if I have other significant symptoms that are causing me distress. So some women with endometriosis have very significant diarrhea, constipation, nausea, or vomiting that comes along with it. Some have very severe headaches or feel like they're passing out. A lot of that is just that pain, and especially if it's endometriosis, it can implant in other parts of your abdomen, like your bowel, and cause these other symptoms. So, all of that to say is that if you can't get through your normal day without being able to function, that is absolutely not okay. Now, certainly for many women, they maybe take a dose of medication at the onset of their symptoms. That's probably okay. But if it's accompanied by those other more severe symptoms, especially if it's lasting more than the first few hours of your cycle, absolutely worth continuing to raise a red flag and say to your doctor, this is not normal and I don't want to keep suffering.
This is so helpful in terms of differentiating it. Could we switch gears here? Because there are so many aspects and symptoms that you can guide us through. I really wanted to touch base on postpartum menstrual cycles or postpartum emotional fluctuations, postpartum depression, because I know that you also take care of those women, right? So, what's happening? So, postpartum, what are these women presenting you with? Like, why are they seeking care from you? And what would help them to understand that, okay, if I'm going through so and so symptom or something which is so prolonged, do I see my gynecologist or do I see some expert as yourself?
Yeah. So postpartum, there are kind of again a few categories that it falls into, and probably the most profound for treatment and for evaluation that we see is for people that are struggling with postpartum depression or postpartum anxiety. And what happens physiologically after you give birth, it's this terrible trick that nature plays where your hormone levels crash. And it basically is almost as if your body goes into instant menopause overnight. So your progesterone levels drop, your estrogen levels drop. And, yes, you've got this hopefully, holding your beautiful baby and everything is great with the world. But when your hormone levels were surging during pregnancy and you felt great, and now all of a sudden overnight they tank, for many women, that significant fluctuation of hormones can be really, really problematic. And so we find estimates are that, again, 1 in 6 women will suffer from postpartum depression or anxiety. And for some women, there are other factors absolutely that play a role. So we always look at what are the other pieces. Maybe baby is not sleeping well at night or not feeding well, or maybe mom had underlying depression or anxiety. But in many cases, it truly is this just hormonal drop. And so one of the favorite treatments we utilize is that we replace progesterone levels. And the studies that we look at say that about 80% of women feel better within 24 hours with just a single dose of progesterone. Now, for some women, we need to continue that. For some, that doesn't quite do the trick. And we always are looking at the other pieces. But if we can restore the hormones for many, many women, it can be a game changer, literally overnight. And so postpartum depression is one of those that we take very seriously. And certainly if that's not working for to replace the hormones, absolutely we're an advocate for all of the other modalities, counseling, therapy, medications if needed. But because we can get such rapid relief by helping to improve the hormones, that can be a game changer for many women. The other would be is what happens with your cycles after you've given birth. Now, a lot of this is going to depend on if you are a mom who is either breastfeeding or pumping. Cycles can be very irregular over time. And so, a lot of the education that we provide is evaluating what's going on with your cycles, what's happening with your hormones. And in many cases, it's just saying, you know what? Yep, this is normal and that's okay, but helping you to identify when are we going to see things return to normal. Now, sometimes somebody isn't breastfeeding or pumping and their cycles are still all over the map. And I always imagine that when babies are inside in utero, that they're like flipping switches and cutting wires and turning knobs and adjusting the hormones. And so sometimes postpartum, menstrual cycles get a whole lot better. Sometimes they get a whole lot worse. And so, really, a lot of that is just sorting out what's normal, what's not. And the other thing that's very common, and I'm sure you see this in your own practice, is we see a lot of other endocrine abnormalities that pop up postpartum, things like thyroid dysfunction or adrenal insufficiency, or in these moms that aren't getting much sleep, we see their cortisol levels are all over the map. And so a lot of that is just in playing detective and figuring out which pieces might be playing a role that could be flipping that switch on what's happening with the menstrual cycles. And so I love working with postpartum women just because we can make such a big difference. And again, I think it's another time frame that women are often told, this is just the way it is, or yep, you've got a baby, welcome to motherhood, deal with it. And the reality is we can do so much better in many cases and help women not only feel better, but also have a better understanding of what's normal and what is not and how we can fix it if it's not normal.
Very, very impressive. There's so much out there, right? I feel like we are in a era where we have access, we have resources, we have physicians as yourself, providing this knowledge, and just more experts, professionals, I would say, healthcare professionals, physicians out there educating in women's health in the entire spectrum of the life. This is so, yeah. I'm just marveled with what you just said. This was our postpartum phase. Now you also talked briefly about that how it's important for males or men to also recognize that there is this male factor in fertility, and we've had these conversations on our other episodes. But from your experience, again, your clinical expertise, when a couple is seeking, the approach that you provide for conception, and you're identifying, you're getting the evaluation, what are your conversations with the male counterpart?
Yeah. So this is one of the most challenging pieces because males don't have a cycle that they can track. They oftentimes can feel completely normal, but they can still have problems with their sperm counts or their overall health. And the other that we identify is, and this is not a generalization across the board, but many times men are much more resistant to seeing a doctor and making some of those changes unless we can identify, hey, there's something specifically that's going on. So every once in a while, I get a guy that comes in and says, I feel like garbage and something is going on. But most of the time, we find that if there is a male factor that we identify, he might feel completely fine. And I think that's one of the most challenging pieces is that you can have sperm counts that are normal or high or low, and you might feel the exact same. The other that's tricky is that we look at more than just sperm count itself. We look at many other factors as far as the motility. So, how well do they move? What do they look like? All the way down to what's the actual DNA makeup? What's the quality of that sperm? And again, guys can feel completely normal and seem just fine and have no problems as far as sexual function, but they can have problems with the actual DNA quality of the sperm. So, it does take some detective work sometimes to figure out, are there factors there that are playing a role? And then also to make those changes. And so even for guys, we're always talking about lifestyle changes. And for our guys, if you have any males that are listening that may be struggling with fertility concerns, we're always talking about getting regular exercise, getting regular sleep, reducing your stress levels, eating healthy, getting rid of processed foods. And probably the most important that people forget about is that we want to get rid of any sort of street drugs, anything that's illicit, as well as limiting the amount of alcohol and eventually trying to get rid of completely any cigarettes, vaping, or anything else like that. And this is not a discussion about what's legal or what's okay or what's not, but all of those things have been found to lead to decreased sperm counts and decreased sperm quality. And so really for guys, it does become this huge lifestyle change for many of them. Whereas, oftentimes the female partner is already doing all of these things and then trying to convince the guys that they have to come along for this journey as well. And where that becomes important is that when we break down overall infertility, we find that about 50% of the time there's just a female factor. About 20 to 25% of the time there's just a male factor. And then the other roughly 20 to 25% of the time there's factors for both male and female. And so because we know that male factor plays a role in up to 50% of cases, it's absolutely crucial that even from that first visit, we're talking about how are we going to assess male factor fertility as a part of this whole process. Because if we're just focusing on the female side of things, we're missing up to 50% of the picture in some situations. So definitely a little bit more challenging as far as working all of that out, but certainly so important to everything that we do in order to get the success rates that we do.
Yes, yeah. I just want to applaud for the education that you just provided here. So thank you. This was very much needed, because when we have these conversations, I get comments when I'm posting this on LinkedIn about a podcast episode that, hey, women's health, you guys are prioritizing that, or what about menopause, or what about us? And that's why I wanted to really have you answer this question for our men viewers or even the listeners. And also, if women are listening to this, definitely share this with your partner, with anyone who's a male in your life and needs to hear this. It was really well said. You covered all the topics that can affect the male factor, and especially touch points on alcohol, street drugs, smoking, vaping. Vaping is insane, common in our younger adults. I don't know if that's as common in the middle age, or they're not expressing it when we are asking them questions. So, yes, thank you so much to share that. Now, you have this amazing expertise, Dr. Minjeur. I really wanted to ask you and share this with our audience about, yes, we talked about that your actual location is in Iowa, but I feel so many of them out there need this type of, specialty care. So, where are you available? Your website, and how can they reach you? Which states that you take patients from or provide care? And what does it encompass? Like when someone's actually consulting with you or getting that expertise, what's available to them in terms of the care?
Yeah. So there's two main places to find us. The first is our website, which is radiantclinic.com. And from there, there's an option to sign up for a free discovery call. And so my staff will get in touch with you to discuss more as far as your options. If I am not currently covering a state that you live in, there's the option to put that on there to see if we're able to cover you in your state. So even though our physical building is in Cedar Rapids, Iowa, I am licensed to do telehealth in 12 different states right now, including California, Texas, New York, Florida, lots of other Midwest states. And so we always have that updated on our website. And again, if there's people in other states that are listening, if your state isn't listed, click on that discovery call link. We're happy to see if that's something that we can provide in your particular state. As far as medical services, it is amazing how much we can actually do via telehealth. I know a lot of patients get concerned, well, I'd like to meet my doctor face to face, or what can they actually know if they don't actually see me in person? And there is so much that we can do. And really, we've been able to be very successful with doing telehealth all across the country. So that's been really, really powerful. So that's the easiest way to find us is through our website. We're also on social media, Facebook, Instagram, and YouTube. And then I also do have my own podcast. It's called Cycle Wisdom. So if you have a particular menstrual cycle concern or perimenopause or recurrent miscarriages, something else that we didn't get a chance to talk about today that you have additional questions on, go check out Cycle Wisdom, and there's an episode just for you so you can hear more about our approach. I always share a patient story at the beginning of those episodes so you can kind of hear how we would work through a particular situation and be able to really kind of dig into what we would do to solve those situations for those patients.
Wow, that's a great breakdown. So we'll put the links in our podcast and YouTube channel as well. And if you have more questions, you know where to get the right care or get your questions answered. This is Dr. Monica Menjeur's episode, especially for you guys. And we'll see you at the next episode. Thank you so much, Dr. Monica.
Thank you for your time. Have a great day.
You too.